Polycystic ovarian syndrome, commonly called PCOS, is one of the most misunderstood conditions affecting women's health globally. Let's break down PCOS in the next 60 seconds. It's worth noting that PCOS is a leading cause of infertility among women. I specify among women because causes of infertility have the female factors as well as the male factors. Infertility is difficulty achieving a successful pregnancy based on reproductive and medical history, or simply the need for medical intervention such as donation of eggs or embryos to conceive. But today our focus is on PCOS, so let's dive straight into it. PCOS remains a leading cause of infertility among women globally. It often begins in adolescence, and is characterized by two major features. One, ovulatory dysfunction, and two, hyperandrogenism. So there is an excess of the male sexual hormones. The signs and symptoms of PCOS are as a result of excessive androgens as well as the ovulatory dysfunction. Not everybody would have the same symptoms, and there's been a classification for the symptoms of PCOS or the manifestations of PCOS based on phenotypic presentation, category A to D, which I'll not talk about in this video. Before we get into the clinical features of PCOS, it's important for us to understand what goes on, what happens before you start getting those signs and symptoms of PCOS. But remember, like I said, it's down to two things: excess androgens and ovulatory dysfunction.